Another very common thing that patients have are problems with joints. One of the common things we see is this thing called tennis elbow. That's pain in the lateral portion, this part of the elbow. And it's due to doing too much of sort of this motion. Okay, and the reason it's called a tennis elbow is tennis players will try to put a spin on the ball by arcing their racket over the ball to giving the ball a top spin. So this area is inflamed. Whenever you touch it, do this motion, it's extremely painful for the patient. So one of the ways we treat it is with stem cells. So what I'm going to do is during the procedure, we're going to take out some blood, not a lot, spin it down with a centrifuge, get out the stem cells that are hidden in the red blood cells. So in the red blood cell, there are all these stem cells, and with the centrifuge, it's going to shatter the red blood cell, exposing the stem cells, and we're going to take those stem cells and inject it into the lateral condyle there. And she had previously had this treatment before, and it helped a lot and got rid of a lot of her pain, so we're just repeating it here during the surgery. So basically what we did is we took blood from the patient and put it in a centrifuge, spun it down, and the stem cells are now in the syringe. And what we're going to do is inject it into areas of inflammation. And in this patient, we have this area called the lateral epicondyle, or as you know it, the tennis elbow. So we marked out preoperatively where it hurts the patient, and it hurts her along this tendinous insertion as the tendon inserts onto the bone. So what we're going to do here is we're just going to inject it in these two little spots there. So Talia is going to go first here, and she's going to go perpendicular to the skin and just come right down on that dot and go right onto the bone, and then come off like a millimeter, and then inject about 3 cc's into each little spot here. And over time, the stem cells get to the area of inflammation, and they mysteriously sort of treat the inflammation, and the pain gets better. So that's PRP to the lateral epicondyle or to tennis elbow. So if you have conditions like tennis elbow or other problems of inflammation, we can treat it with PRP. We also use PRP for the scalp for hair growth, to the eyebrows for also hair growth. So it can also be used for different kinds of venues to stimulate things to grow. So if you have inflammation in the elbow, if it hurts you, check with your doctor, and maybe PRP may be a great answer for the treatment of your elbow. So thanks for watching. Please subscribe. We'll see you next time.